Just 10 minutes. That's all it takes for a stroke to steal your ability to speak, walk, or take your life. What's truly frightening? Most people over 50 miss the early warning signs. Why? Because in real life, they don't look dramatic. No clutching the chest, no collapsing like on TV, just small, strange changes that are easy to ignore until it's too late. I've reviewed over 200 medical sources, including Mayo Clinic and the American Stroke Association, and found one simple way to remember the signs. Just 4 letters. It could save your life or someone you love. In this video, I'll show you exactly how to spot a real stroke versus something harmless, when to call 911 without second guessing, and what small symptoms never to ignore. You don't need a medical degree, you just need 5 minutes and an open mind. So please, stay with me. This could be the most important video you watch all year. F. Face drooping. When a smile becomes the warning sign the person can't feel, it doesn't start with drama. No sirens, no collapse. Just a smile that seems off. You're sitting at the table sipping coffee, chatting about nothing in particular. Then you notice something. The smile across from you isn't symmetrical. One side of the mouth sags slightly, the cheek doesn't lift like it used to, and the person smiling, they have no idea. They feel fine. They're laughing, nodding, enjoying the moment. Inside, everything feels normal, but something has changed, and you're the only one who can see it. This is the power and danger of face drooping during a stroke. The part of the brain that controls the muscles of the face can be knocked offline by something as small as a pinhead-sized clot. No pain, no sensation, but the smile fades, not from joy, but from blood supply. Seniors are especially vulnerable. As we age, our blood vessels stiffen and thin. Decades of high blood pressure, cholesterol buildup, or small heart rhythm problems like atrial fibrillation quietly damage the vascular system. It only takes one small clot from the neck artery or the heart to reach the brain and disrupt movement in the face. I remember Mrs. Betty, 74 years old, who had a perfectly ordinary breakfast with her husband until he noticed her face looked uneven. He didn't panic. He didn't wait. He picked up the phone and called 911. At the hospital, imaging showed a small blockage in the artery supplying the facial motor region of the brain. Because he acted immediately, she received treatment during the golden hour. She didn't lose her speech. She didn't lose her independence. She didn't lose her smile. What makes this sign so powerful and so tragic is that the person experiencing it almost never sees it themselves. That's why your eyes as a family member, caregiver, or friend are so important. You might be the only person in the room who can recognize that the brain is crying out for help. A. Arm weakness. When your arm stops listening and you don't know why. Let's shift from the face to the arms. Now imagine reaching for your morning cup of tea and your arm just doesn't respond. No warning, no sharp pain, just weakness. The mug slips. The hand can't lift the toothbrush. The arm feels like it's no longer yours. This happens when the stroke hits the motor strip of the brain, the area responsible for voluntary movement. Again, each side of the brain controls the opposite side of the body. If the left side of the brain loses blood flow, the right arm goes limp. What's particularly dangerous is how easily this can be dismissed. Many people think they just slept wrong, or maybe they pulled a muscle gardening the day before. But stroke-related arm weakness isn't sore. It isn't stiff. It's sudden. It's strange. It's silent. Here's a quick test that can save a life. Ask the person to raise both arms and hold them out straight for 5 seconds. If one arm starts to drift or falls completely, that's not muscle fatigue. That's your brain losing control. Mr. Bill, 68 years old, didn't think twice when he dropped his toothbrush. But when he tried again and couldn't lift his arm, his wife made him try the 2-arm test. The left arm stayed up. The right arm fell instantly. Within 35 minutes of the 911 call, he was in the ER. Doctors found a clot in the area of the brain controlling movement. He received clot-dissolving medication, and within 3 weeks, he was back to normal. This is why awareness matters. Arm weakness isn't always part of dramatic collapse. Sometimes it's a quiet failure of communication between the brain and body. and a quiet opportunity to save someone's future. Letter S, speech difficulty. When you know what you want to say, but can't say it. Let's talk about words. Most people don't realize how miraculous speech is until the words get stuck. You know what you want to say. You can hear and understand everything around you. But when you try to speak, the sentence falls apart. You say the wrong word. You slur. You freeze mid-sentence. Not because you forgot, but because your brain and mouth have stopped working together. The speech centers in the brain, usually on the left side, are complex. One area forms words, another interprets them. If blood flow stops to either, communication breaks down. And the heartbreaking part is this. Most people having a stroke don't know their speech is affected. In their minds, they sound fine. The listener, the spouse, child, friend, must catch the problem. This is what happened to Mrs. Linda, 71 years old, retired teacher, grandmother, and the storyteller of the family. One night over dinner, she was halfway through a story when she suddenly stopped. Her mouth moved, but no words came out. Her family waited. Then her grandson, only 10, remembered the fast signs from school. "Grandma," he said, "try to say, 'The weather is nice today.'" She couldn't. He turned to his parents and shouted, "Call 911." 22 minutes later, she was in the emergency room. 4 days later, she was speaking again. 6 days later, she finished the story. The simplest test, a short sentence, can be the turning point. If someone's speech sounds strange, slow, or they can't speak at all, don't wait. Don't assume they're tired or emotional. That moment may be your only window. Letter T, time to call 911. Every minute of delay is a part of the brain lost forever. All the signs in the world mean nothing if you don't act. Stroke is a thief of time, and time is brain. Every minute that passes during a stroke, the brain loses nearly 2 million neurons. That's 2 million brain cells gone every 60 seconds. Memory, movement, language, understanding, all at risk. Here's what too often happens. Someone sees the signs but hesitates. Maybe it's not serious. Let's wait a bit. Should we check online first? In the time it takes to second guess, the opportunity for clot-busting treatment can close. Stroke doesn't wait. And even the best hospital in the country can't reverse damage that's already done. If stroke treatment begins within the first 3 hours, the chance of full recovery can be as high as 70%. But after 5 hours, that number drops below 20%, and the risk of bleeding into the brain skyrockets. I once read the story of a 76-year-old man in Indiana. He was speaking with his wife when he suddenly stopped mid-sentence. His right hand didn't move. He insisted he was fine. "I can still hear you." They waited. 15 minutes passed. Then he couldn't speak at all. By the time they reached the hospital, the damage was permanent. He survived but would never speak again. One call, 20 minutes earlier. That's all it would have taken. This is why the letter T, time, isn't a suggestion. It's the call to act. You don't have to be sure it's a stroke. You only have to suspect. Because calling 911 immediately isn't overreacting. It's giving someone a chance to live with dignity. Not every stroke follows the familiar fast pattern. Some begin subtly with symptoms so vague they slip past our notice. But those elusive signs can carry the weight of life or lasting harm. Let's journey through 5 such warning signals you and someone you love should never ignore. 1. Loss of vision in one eye, when half your world vanishes without any pain. For adults over 60, sudden vision trouble is often brushed off as cataracts, fatigue, or just old eyes. But there's a specific kind of vision loss that should trigger an alarm. This occurs when sight abruptly goes dark in one eye, often for a few fleeting minutes. No pain, no redness, no blurriness. At first it might not feel frightening, but imagine a curtain falling over part of your vision, or half your world fading into shadow. This isn't an eye problem. It's a brain warning. A mini-stroke, also called amaurosis fugax or transient monocular vision loss. It happens when blood flow to the retina or optic nerve is briefly blocked, often by a clot from carotid arteries or the heart. It may resolve fast, but it signals real danger. Studies show that 5 to 10% of people with this warning develop a full stroke within 3 years. That was the case for Ruth, 70, in suburban Chicago. While putting away groceries, one eye suddenly went dark. No pain, just emptiness. She blinked, rested, and the eye cleared. 3 days later, she collapsed on a walk. Doctors confirmed a stroke and said that fleeting vision loss was her first real warning. She survived, but eyesight in that eye was gone for good. The lesson: when vision vanishes in one eye, even for a moment, it's not just tired eyes. It's an emergency. The eye can't heal itself forever. If the brain doesn't get blood promptly, damage becomes permanent. Act immediately. What feels like a minor glitch may be your body screaming for help. 2. Sudden severe headache. When your head feels under attack. Some strokes don't begin with face drooping or arm weakness. For some older adults, especially those with hypertension or fragile cerebral vessels, the first sign is a headache like no other. It comes on abruptly. The worst headache of my life, sometimes likened to being struck or feeling internal pressure spreading through the skull. Nausea, dizziness, blurred vision may follow. This often signals a hemorrhagic stroke, when a small vessel ruptures and bleeds into the brain. Although less common, it's far deadlier. According to the CDC, about 10% of stroke patients who report a sudden, intense headache are actually experiencing a brain bleed. But more than half thought it was just a migraine or weather-related. Women over 60 face triple the risk due to post-menopausal changes that weaken vessel walls. Consider the story of a healthy 68-year-old woman in Texas. During dinner, a lightning bolt headache struck. She spoke in slurred words and asked for water. Her family thought it was low blood pressure. 20 minutes later, she passed out. Doctors found a brain bleed from an undiagnosed aneurysm. If help had come when the pain first hit, the outcome might have been very different. A sudden, overpowering headache isn't just pain. It could be blood invading the brain. Even if it feels like nothing before, if it's sudden, intense, and unlike prior headaches, or comes with nausea, blurred vision, or confusion, don't second guess. You don't have to know the cause. Understand that in hemorrhagic strokes, minutes count. 3. Confusion and inability to understand speech. When the world becomes a foreign language. Not all strokes knock you down. Some land softly, stealing clarity. One sign often dismissed as aging is sudden confusion. When someone drops a normal conversation, fails to comprehend what's being said, or starts answering with strange words, as though their mind has wandered into another world. We tend to associate strokes with motor symptoms, like weakness or facial droop. But when a tiny clot affects language or comprehension centers, the brain fails to interpret sound or form coherent language. The vulnerable person hears voices, but the meaning is gone. They may respond with bizarre phrases or make no sense at all. At breakfast one morning, an older woman asked for the cloud thing to brush my teeth. Her daughter laughed it off. But when repeated, the woman stared blankly, silenced. Within 30 minutes, she couldn't speak clearly. It wasn't confusion. It was a stroke in the language center. Indeed, nearly a quarter of strokes in those over 65 involve sudden confusion or language breakdown. Yet families often chalk it up to age or a senior moment. So if someone suddenly seems not themselves, unable to understand speech, speaking oddly, or confused, don't wait. That moment may not be a memory lapse. It may be the brain losing language. Speak up, act. That quiet confusion may be a call for help. 4. Numbness on one entire side. When your body stops feeling real, there's a kind of stroke that doesn't tilt your face or stall your speech. Instead, it flips off sensation. A limb marches, but it's ghostly. The person can still talk and smile, but their hand slips off the table or their foot drags unnoticed. At age 60, loss of feeling sometimes seems normal, like that morning when your foot is numb from sleeping on it. But stroke numbness is different. It strikes one side suddenly and doesn't vanish when you shift position. You may fail to sense weight, the breeze, or whether your foot rests on cool ground. In strokes affecting sensory areas of the brain, The problem isn't a nerve or circulation to the limb, it's the brain's disconnection from body signals. Evelyn, 72, living in Ohio, experienced this while buttoning her shirt. Her right hand dropped the glass she was carrying. She blamed cold fingers. An hour later, her whole right side went numb. MRI confirmed the brain had lost sensation from lack of blood. The numbness itself isn't the real threat. It's what you don't feel afterward. If you can't sense danger, you can't prevent harm. Whether fleeting or persistent, sudden numbness is your brain's alarm bell. If ignored, you may never feel again. 5. Dizziness, vertigo, loss of balance. When your legs betray you? After 60, feeling a bit unsteady or lightheaded may seem ordinary, perhaps from low blood pressure, medications, or mild dehydration. But when dizziness arrives suddenly, severely, paired with staggering, difficulty walking, or a toppling feeling without obvious cause, a hidden stroke, often in the brainstem or cerebellum, may be at work. That region controls balance, coordination, and spatial orientation. Interrupt its blood supply, and you may sense spinning even at rest, feel pulled to one side, or walk as though drunk. In extreme cases, sitting upright becomes impossible. Vomiting is relentless, and there's no fever or stomach upset to explain it. This kind of stroke is frequently misdiagnosed as an inner ear issue. Johns Hopkins reports that about 12% of strokes in this part of the brain are missed on first assessment because fast signs aren't present. A 66-year-old man in Florida experienced this. Upon rising, his house felt tilted. He stumbled to the kitchen but couldn't steady himself. His wife thought it was low blood pressure and told him to rest. 3 hours later, he lost strength on his left side. Doctors confirmed a stroke in the lower brain. They said just 2 hours earlier, treatment could have nearly restored him. That is the weight of this sign: sudden vertigo, imbalance, or severe dizziness, even if you don't feel out of breath, may be a brain on the edge. Don't accept wobble as age or tiredness. It could be your brain pleading for rescue. If this happens, act. Life doesn't always dramatize warning signs. Sometimes it whispers them under a veil of normalcy until the moment becomes critical. Remember, sudden loss of vision, terrible headache, confusion, one-sided numbness, or vertigo can all be strokes in disguise. In stroke care, time isn't just money, it's brain. Early recognition means the difference between recovery and lasting loss. Share these stories. Spread awareness. Your vigilance may be the bridge between damage and recovery. Knowing the warning signs of stroke is crucial, but what's even more important is not waiting for those signs to show up before you act. Unlike the heart, the brain doesn't get a second chance. You can't undo the damage. If blood flow is cut off, even for just a few minutes, the brain cells that die don't come back. That's why prevention has to start now, every single day, with small actions that are easy but powerful. Make sure someone around you knows how to call 911, especially if you live alone. High blood pressure? Check it daily, even when you feel fine. It's silent but deadly to your brain's blood vessels. Learn the FAST method and repeat it monthly. Face drooping, arm weakness, speech problems. Time to call 911. Say it out loud. Teach it to someone. It could save their life or yours. You don't have to give up your favorite foods. Just tilt the scale. More plants and fish, fewer fried and processed foods. Your brain will thank you with every bite. And most of all, listen to your body. Feeling off, confused, or heavy in one limb? Don't wait. Don't brush it off. Act immediately. Stroke doesn't give warnings, but your habits can give you protection. If you've ever felt numbness, slurred speech, or sudden weakness, take it seriously. The right move at the right time can save you from a lifetime of dependence. If this message spoke to you, please don't keep it to yourself. Share it with someone you love. And if you want to stay strong, independent, and informed, subscribe to Senior Health Guide. We're here to help you live smarter, longer, and on your own terms.